Hey folks, thanks for tuning in. The following video is part of a larger series of videos that will be released over the upcoming year. The target audience is therapists, counselors, social workers, and clinical supervisors. We're going to be talking about issues in clinical practice. But if you've ever been a patient, or if you're just curious about the field, you might find this interesting, so stay tuned.
Hi, my name is Ayoka, and I am a licensed master's level social worker. The qualities I look for in a good supervisor include one that is knowledgeable about the field, the clients that we serve, and the work that we do, one that is supportive and there when you need them, and also one that encourages self-initiative and self-starting.
For me, an important trait in a supervisor is someone who is well versed in the ethics of our profession so as to provide the supervisee with a strong risk management based perspective for difficult cases.
The number one thing that I would look for in a clinical supervisor in a mental health setting would be someone who has a lot of experience with diagnostics. I found that learning diagnostics is one of the most difficult and challenging things as a new mental health therapist or counselor. And so having that type of support is extremely beneficial.
So one of the biggest things for me with a supervisor is someone that will offer support, someone who doesn't feel the need to micromanage me and trust me to know what I'm doing, but still offer support and guidance when we meet.
I feel like the traits of a good clinical supervisor would be someone who not only helps with the administrative side, such as documentation and treatment planning, but more importantly, challenges me to be stronger and empowered clinically. In my supervision, I value someone who is going to encourage me to get out of my comfort zone and really allow me to confront any of my personal barriers that keep me from being a great therapist.
When looking for a supervisor, I look for someone who is supportive, a good motivator, and approachable.
I prefer a supervision style that lets me use the skills and knowledge that I have in my practice on a daily basis, but I also like to be able to freely receive feedback about the services I provide so I can make sure that I'm doing the best for each patient interaction.
And looking for a clinical supervisor, I would look for someone who's able to keep me on task with staffing cases, making sure that I'm addressing all needs individually and not just falling into a pattern. Someone who is able to call me out if I am not able to stay on task, or if they're noticing patterns that might not be helpful to my patients, and also looking for someone who would be able to keep me on track with current ethics or changes in policy, ethic codes, and making sure that I am practicing in the most competent, ethical way.
Okay, so I was lucky enough to get my supervision hours through my agency, but when I was looking for a supervisor outside of our agency, the thing I was looking for is someone who would make me think critically, provide a different perspective, someone that could assist me in keeping up with research, because I think that's really important in our field to know, how to explain why we're doing what we're doing and also explain results. So somebody that could help me keep up with that research. And then finally, just someone who gives me constructive criticism and feedback while also being supportive.
And so I am actually currently looking to start my LISW, and the qualities I look for in a supervisor is somebody that's able to provide like a different perspective on clients, who's willing to give and who will give constructive feedback and criticism on clients, and to just help with growth overall in the field. And then someone who's just overall supportive. So those are things that I really focus on the most.
Okay, finding a supervisor for me, the most important thing was affordability. So it works perfect for me that I get to use my actual supervisor who also provides clinical licensure supervision for me on the job. And then I get some really great feedback because she knows me so well clinically, and it's just worked out really well for me.
What I look for in a supervisor is a person that's approachable. It can be a jarring situation to be supervised by someone. It can sometimes show and reflect our struggles in our clinical lives and our personal lives. And so someone that I can come to on a professional level and a personal level saying, this is how I need support. This is how I need feedback. What are you noticing in my work? How can I be best supported? Is really and has been one of the greatest gifts to my career as a therapist.
Hi, my name is Rebecca, and I'm an MSW, LCSW licensed in Massachusetts, where I've worked for the past 20 years, primarily in medical social work. I was asked recently, what are the qualities of a good social work supervisor? And I think, aside from the important qualities of being responsive, supportive, having a strong sense of professional ethics, it's important for a supervisor to really help a new social worker navigate the dynamics of a professional workplace, I think, in terms of developing professional boundaries, not only with their potential clients and patients, but also staff members and managers they might be working with. I think this is very important for many reasons. Also, I think a new social worker really would benefit from the supervisor being present in a mindful way. Working with them can help remember where the social worker is at, the new social worker is at, just so that they can work effectively from there and do good work and develop new, strong social workers.
So what do I look for in supervision? First of all, I look for a supervisor who is relatable. I want that person to be able to relate to me, be able to relate to them. I want to feel a connection with that person, because then connecting with that individual, being comfortable with being able to go and talk to them about the things that I'm needing in a supervisor for supervision. Also, I'm looking for somebody that's going to challenge me in supervision, not just let me come in and just talk, but challenge what I'm saying and make me think about the things that I'm saying and how I am arriving and at what I am arriving about when it concerns my clients, my patients, and that person is going to make me look beyond what I may just see.
I feel that in order for clinical supervision to be effective and help launch your career in the way that you'd likely prefer it to be, that you honestly should be looking for some of the same qualities in your clinical supervisor that you would be expected to have as a clinical therapist yourself. You know, the basics: trust, knowledge, confidence, cultural awareness, ongoing education, etc. I've had many clinical supervisors over the years, even after I was licensed as a clinical social worker myself. And the supervisors that have had the most promising impact on me were the ones who I was able to establish an alliance with. You hear the term therapeutic alliance with the clients that you serve. You actually need that with your clinical supervisor.